This week's Ask Dr. Durie is an important question that I don't believe that we've ever touched on before. And the question is, how is it that the IMF works to accelerate new drug approvals? Well, the answer is that we actually work very hard, and I believe this questioner is referring to something that we call the IMF's benchmark program. And so this is a program in which the IMF works with centers all around the world to gather up detailed chart information about patients at different stages of the disease. Related to new drug approvals, it is especially important to gather up the information on patients who have gone through all of the currently approved therapies. This is important because if a patient has gone through all of the current therapies, this means that they fall into a category that the FDA calls unmet need. This means that they've gone through everything, they now need something else to get a new response. But to evaluate the impact of a new drug, you need to know, well, what would happen if the new drug is not available? And these are the details that we gather from this careful and very rigorous chart review that we conduct at 20 to 30 centers all around the globe where this type of detailed information is gathered and collated and filed electronically. And so we reach out and we gather what is called patient-level data. And so we, in an anonymous fashion, a very careful HIPAA-protected fashion, gather the details of what has happened to each one of these individual cases. And so for patients who have relapse refractory myeloma, we gathered up between 300 and 400 case report forms, and we analyzed, well, what is happening to those patients? And so in the absence of the new drugs, approximately 5 years ago now, we discovered that the outcome of those patients was really rather poor, with a very short length of remission and a very short overall survival without access to new drugs. This turned out to be incredibly important because right at that moment, the new drug carfilzomib had been submitted to the FDA as a single-arm study looking at the efficacy and the toxicity of carfilzomib in relapse refractory patients. And the FDA desperately needed something to compare with the results. What would have been expected and what happened with the carfilzomib. And so it was spectacularly important, and at the time of the FDA review, not only did we have testimonials from patients who had responded to carfilzomib present in the room to testify about the value, but we had in fact supplied the comparator, the information to say, well, this is what would have happened if the patient had not had access to the carfilzomib. And so we have little doubt that this had a huge impact and was one of the key factors in allowing the FDA to feel comfortable in going ahead and supporting approval of this drug. And so this is an example of what the IMF is continuing to do, because now moving forward, the goalposts keep shifting. New drugs are introduced, and so now there is a new unmet need. Patients who have gone through all of the current therapies, and now we have a point where patients have received Revlimid, pomalidomide, Velcade, and carfilzomib. And this is something that we call quad refractory or 4 drug refractory patients. And this is a new terminology that you may be hearing more of. Quad refractory, this is the new unmet need population. These are patients who desperately need access to more therapies. And so right now we are in the process of analyzing the outcomes for those patients that will be used in upcoming drug approvals. For example, the exciting new monoclonal antibodies, such as I think the first possibly coming up for review will be daratumumab, the anti-CD30A monoclonal antibody. We are in a separate analysis looking at patients who have had 1 to 3 prior therapies, 1 to 3 prior relapses. And so in this setting, we are looking at outcomes that will be used to compare with the results with elotuzumab, the anti-SLAMF7 monoclonal antibody, which works in combination with Revlimid and Dex. Again, we need to know what would happen in the absence of this combination. What would we really expect? And this is incredibly important information for FDA review, and in fact for everyone in the myeloma research and patient community to understand. And so, although this is the first time that this question has been asked, and it's the first time that I've really talked about this in any detail, this is really a key program and is just a very important example of how the IMF contributes in this, what I think is a very substantial and significant way to the acceleration of drug approvals and achieving one of the IMF's goals, which is always to be trying to help the myeloma community in any way that we can. In this case, hopefully accelerating the access to the new drugs. Because even if a drug is available in a trial, that is definitely not the same as approval. For patients to have wide access and to be able to get a drug, it just needs to be approved. It needs to be safely approved where we know that it's effective and safe, and we need that input. But then we need it to be widely available for patients everywhere. And so we are, as the IMF, very grateful that we have been able to help and contribute in this way to move drugs forward in an expeditious fashion.